Welcome to the deep dive. Today we're jumping straight into clinical lab results, specifically the standard metabolic panel. And I have a question for you. Are you aware that a number on that report, the total calcium, might be completely lying about a patient's health?
It's a massive blind spot, and it's so common. Our sources really highlight this crucial relationship between calcium and another value, albumin.
Okay.
And if you just look at that raw total calcium number, you are very often being misled about what's actually happening in the body.
That sounds alarming. So we're not just talking about the fact that calcium binds to albumin. I think most people know that. We're talking about what happens clinically when that binding protein albumin is low.
That's it, exactly. The problem is something called hypoalbuminemia, low albumin.
Right.
If the patient has low albumin, the total calcium measurement will drop simply because there's less protein for it to hold on to.
So it's an artificial drop.
Yes. But here is the critical distinction. The active functional form of calcium, what we call ionized calcium, that might be perfectly stable, perfectly normal.
Wait, hold on. So are you saying a patient who looks, severely hypocalcemic on paper is actually totally fine?
They could be. And that misinterpretation could lead to incorrect clinical assumptions, maybe even
unnecessary treatment.
Precisely. You see an 8.5 calcium reading and you start intervening without checking the bigger picture. You've skipped the most essential step. We need to correct that data.
Okay, let's introduce the fix then. The calculation is the key here. What's the critical formula we need to know?
This is the equation you need to remember. It's corrected calcium equals the measured calcium plus 0.8 multiplied by the result of 4 minus the albumin level.
So corrected Ca in milligrams per deciliter equals measured Ca plus 0.8 times 4 minus albumin.
That's the one. And it's interesting, the 4 is just the accepted normal baseline for albumin, and the 0.8 is the standard correction factor for the binding ratio.
That context helps. Okay, let's make it concrete with that example from the sources. So you have a measured calcium of 8.5. That's low. It's ringing alarm bells.
It is. And the albumin is also low, say it's 2 grams per deciliter.
Okay.
But if you apply the correction, you take that 8.5 and you add 0.8 multiplied by, 4 minus 2 is 2.
So that's 0.8 times 2, which is 1.6.
Yep. So you're adding 1.6 milligrams per deciliter back to the measured number.
And the aha moment result, 8.5 plus 1.6 gives you a corrected calcium of 10.1.
And 10.1 is perfectly normal.
Wow. So the patient was never actually calcium deficient?
Not at all. That correction prevents you from misdiagnosing hypocalcemia. It stops you from potentially starting a patient on calcium they don't need, which has its own risks.
Right.
I mean, that's the real power here.
So the takeaway is simple. Never trust a low total calcium reading until you check the albumin level.
And run the formula.
It's really the difference between seeing a data artifact and seeing reality.
Absolutely. And the final thought we want to leave you with is this. When you are faced with a data point that seems off, like a low total calcium and a low albumin, is your immediate instinct to accept that raw number? Or is your first step now to perform the mathematical correction? That ability to critically analyze the data before you act, that's everything.